We're in a desperate situation, and when you see the modeling, you'll fall off your chair.
Meow, Huples cat. This is a pandemic update. I said I'd do them every week or so, and I'm going to do this one. I'm recording this on Friday the 8th of December. Tonight, Friday night, myself and Kitty are going to work. Kitty works as an ICU nurse at a major teaching hospital in downtown Toronto, and I'm the administrator on nights there. I am a nurse from background, and I'm the only administrator, the only manager there for the whole entire campuses at night. So we've got a better idea of what Rob Ford has been going on about than maybe perhaps a lot of people have. It is absolutely dire. It's been dire all week. We're running out of staff and we've ran out of beds. Like, we've ran out of ICU beds. We've been moving patients between our hospital and other hospitals in the GTA. As we fill and get out of control, we send it to empty beds available. As they get out of control, they've been sending it to us. But frankly, we're out of beds. And the numbers in the community continue to rise. Now, I will discuss this, and I will have more from Rob Ford later. I don't actually blame the people the government's blaming. But let's get into this. Let's do a quick roundup. Some of them will just be standalone videos, and some of them I will actually interject and talk about them. There will be some hospital stuff and some hospital information from last week that I'd like to share, because I do think it's important that people understand what is actually going on, rather than wait till next week to be revealed that the situation is dire. By next week, the situation is dire, and people have already fallen off their chairs, and people are getting sick.
And folks, I just can't stress this enough. When you see the modeling, I think it's coming out Monday or Tuesday, somewhere early, I think it's Tuesday actually, there's going to be a wake-up call, a real wake-up call. And no matter what the federal government, no matter what the provincial government does, municipal governments, if we don't have the cooperation of the people, this is going to get out of hand. I just can't stress it enough.
People are getting very, very frightened in the healthcare system because we're not sure we're able to treat strokes and heart attacks, let alone do surgeries on cancer, let alone all of those things. The good news is that outpatient stuff should be okay. Dialysis should be okay. We don't know it will be at this point. But we do know that we are absolutely flat out of beds, flat out of ideas, and flat out of staff.
Criticism continues over the slower than expected vaccine rollout. But now the head of Ontario's vaccine task force says we will soon run out of doses if the province doesn't get more, and quick.
We still do not know when the shipment that was predicted for next week of Pfizer vaccines will arrive. And so we will be out of the initial ones by the end of this weekend, and by end of next week, we will be out of the shipment that is going to arrive in this next several days here.
The Ford government is now urging the feds to increase supply to Ontario. Provincial officials also announcing all residents and workers at long-term care homes in Toronto, Peel, York, and Windsor, Essex will get the shot by January 21st.
In a country overwhelmed by COVID, sweeping vaccine demand has spawned massive logjams like this one. Houston unveiling its first vaccine clinic today. Hours later, call centers were swamped.
I counted on my phone over 400 calls that I tried to get through and never got through.
He's 76 years old and got issues, so we need to be in this line.
Spanning from Texas to Florida, seniors waiting in line for hours.
There was like people in front of me in their late 80s and they could hardly walk, and they were sitting out there that whole time too.
And in Tennessee, the police actually had to turn people away.
Some of us are getting the car and put it along the curb and just sitting in the car to try to stay warm and not get tired.
Yet despite the desperation, the national figures for vaccinations are stunningly short of expectations. The federal government promised 20 million immunized by year's end, but a CDC dashboard shows more than 14 million doses distributed and fewer than 3 million vaccinations.
He's having a really hard time breathing.
It may be a new year, but for embattled healthcare workers, it's the same old fight.
Things are really bad. We're overwhelmed.
I've never seen a healthcare system pushed to the level that we're at.
There are vaccines, of course, but not as many as promised, and no centralized plan to actually get them into people's arms. That was left to the states.
This is the federal government abdicating its responsibility, leaving this up to the states, just like they did with testing, and we saw what happened with testing.
And so, vaccinations now millions of doses behind schedule as the vulnerable vie for a spot in line.
It's horrible that somebody would do that on purpose, deliberately do it.
Little wonder there's outrage after a Wisconsin pharmacist was arrested for deliberately taking more than 500 doses of the Moderna vaccine out of refrigeration, likely rendering them ineffective.
My reaction is I hope he sits for a long time, because there's people that should have got those shots. And what if they get the virus now?
Dozens received shots from the thawed batch and might now have to be revaccinated.
The 57 recipients of those vaccines have been notified.
Health experts weighing in after a local nurse tested positive for COVID-19 8 days after receiving the Pfizer vaccine. As ABC 10 News reporter Michael Chen tells us, a doctor involved with the local vaccine rollout says this case does not reveal anything about the vaccine's effectiveness.
This was a Facebook post from Matthew, an ER nurse at 2 different local hospitals after receiving the Pfizer vaccine December 18th. He tells me his arm was sore for a day, but he suffered no other side effects. 6 days later, on Christmas Eve, after working a shift in the COVID unit, he became sick, he writes in another Facebook post. He got the chills and later came down with muscle aches and fatigue. The day after Christmas, he went to a drive-up hospital testing site and tested positive for COVID-19.
Not unexpected at all, and when you work through the numbers, this is exactly what we would expect to happen if someone is exposed.
Dr. Christian Ramers is an infectious disease specialist on the clinical advisory panel for the county's vaccine rollout. He points out it's possible Matthew may have been infected before receiving the vaccine, as the incubation period may be as much as 2 weeks. But Dr. Ramers says if Matthew did contract it after the vaccine, it's still in line with what we know.
And we also know from the vaccine clinical trials that it takes about 10 to 14 days for you to start to develop protection from the vaccine.
Dr. Raymer says he knows of several other local cases where healthcare workers became infected around the time they received the vaccine. He says all of these cases illustrate that results are not immediate. And even after you start receiving some protection, it is not full protection.
That first dose gives you, we think, somewhere around 50% protection, and then you need that second dose to get up to 95%.
Dr. Raymer says Matthew's story also shows that even with vaccines, the pandemic isn't going to turn around instantly.
Matthew said he was surprised on his Facebook page. Matthew's an ICU nurse. Matthew needs to study and learn about this disease in more detail. It's absolutely been known right from the beginning that it would take 10 to 14 days before the vaccination starts to increase protection from the virus. This has been well known, and I'm shocked that he actually thought he was protected because he had one shot immediately. So there is the thing. A lot of people out there are actually anti-vaxxers. A lot of people are not. The vast majority of healthcare workers are absolutely desperate to get this vaccine. Now, what's the situation in Toronto, Ontario on the 8th of January? Kitty, who is a level 3 ICU nurse in trauma, who works rapid response throughout the hospital, actually going to COVID patients when they get sick, who actually is floated and works in COVID ICUs, has not yet been informed how and when she will be vaccinated. The word on the street, and it is rumour, is that Ontario will run out of the vaccine tomorrow or Sunday. It's not a good position. We have used a whole bunch of vaccines on people who needed it. We needed to look at the long-term care, because long-term care is 2/3 of the hospitalizations and deaths. 2/3. It's absolutely critical that they were given that in the outbreak places. The other places should have got 50% of the vaccines, and the ICU nurses and the emerge nurses and the floor nurses who are actually looking after COVID patients should have got it right from the get-go. Some hospitals have been doing that, my hospital has not. It's going to be a very interesting time. We're absolutely desperate to get the vaccine, I can tell you that, but you will get stories like this one.
As a COVID vaccine rolls out this week, questions are being raised by some about safety and side effects.
And it seems that not everyone will be lining up for the shots. WPTV News Channel 5's Matt Stesney looks into the concerns being raised by a local healthcare professional.
Jean-Marie Naser is a nurse in Boca Raton who says she is not getting a vaccine for COVID.
I've looked at the science, I've studied what they have put forth in their studies and their warnings, their precautions and the side effects, and I am not comfortable to say that this is something that would be safe for myself.
She says she found the information provided by Pfizer and available on the FDA's website.
Not only that it's being rushed, they flat out admit that they didn't do the full study. They haven't provided that information, and that they say they'll follow up for 24 months.
It's something that is alarming to doctors like Larry Bush, who is investigating one vaccine trial in Palm Beach County.
We're constantly looking for any side effects, and we're obligated to report them to the FDA.
Dr. Bush says the vaccines at this point have gone through 3 phases of trials, and he is not hesitating to recommend vaccinations.
I just had 5 people in the office today ask, should I get a COVID vaccine when it's available to me? And my answer is, as soon as you can, I would get mine as soon as I can.
This week, Florida began vaccinating healthcare providers as the governor expects over 1 million doses to arrive by the end of the month.
I'm confident that as more and more people get this, people are going to see, you know what, that's something that would make sense to me, and we're going to do it.
The governor says he won't mandate people to get vaccines, which he adds, if several drug makers can win approval for them in the coming weeks, could end up being largely available to the public by spring.
Guns Coast to Coast put up a video, and I'm going to show it. It's an absolutely great video.
So you're so scared, you wear a mask and you put it back on between sips of drink. Get a load of this. Literally wearing your mask in between sips takes it on and off for each sip. Yet you're out in public with the virus. Look, man, either the thing is dangerous or it's not. If you're so frightened you're going to put your mask on and off between sips of your drink, you'd think that logic would apply and that you would stay out of the public. But no. I'll be safe as long as I'm sitting here with my mask on and I can take it off the drink and touch every surface around and have people 2 feet behind me and have people barehanded serve me my food and have the kitchen staff, probably from a lower economic rank, making my food. There he goes again. And his partner.
Absolutely true. This is one of the reasons healthcare professionals told the general public that they couldn't wear masks because you didn't need to, and in fact it might cause more harm than good. For example, as I keep telling people, if you are breathing with virus in the air with a mask on, the outside of the mask will be saturated in virus. So if you're actually touching that, you're going to have more virus on the outside of that mask than would be there if you were not wearing a mask. You'll have more virus on the outside of the mask than if you were not wearing a mask. That doesn't mean you shouldn't wear masks. It means you need to wear them properly and not touch them and take them off properly. And this means not reusing them over and over and shoving them in your pockets and turning the outsides of them. You need a lot of masks. That's why you need to reuse them. That's why you need to bake them at 170 Fahrenheit for an hour or leave them in the sun for a week, or both. That's what I'm doing with my N95s, because they're a precious commodity and my hospital doesn't have anywhere near enough for me to wear them all the time at work, and I've been wearing them all the time at work since the beginning of February. The other thing here is Guns Coast to Coast is absolutely correct. You shouldn't be going out eating and drinking. You don't need to. Home cooking is in, and you can have delivery and leave it for half an hour or so. You can, lots of things you can do, but the very concept that we cannot go out and socially interact and have dates and meet people is beyond people's ability to say, you know what, the risk of death is low. It's only about 2%. The risk of long COVID is maybe higher than 4%, but I need to go out, but if I wear a mask, I'll be fine. No, you won't. When you wear a mask like that gentleman's wearing it, you're in deep trouble. And his partner's doing the same. And if you notice, they both share the same glass of orange juice. Now, eating is not a particular COVID risk. The virus has a hard time infecting you when you take it into the mouth. The mouth is very effective at killing off viruses and bacteria. What isn't effective is the nose, and that is why the mask has to be covering the nose. And as you can quite clearly see, most of the time it's there on this gentleman, so air always takes the easiest route. Not a good thing.
Yeah, this is just an extra resource for these struggling hospitals who are just seeing an influx of COVID patients right now. The Army Corps of Engineers are assessing 7 hospitals in Los Angeles County that are experiencing a strain on their mechanical systems, specifically oxygen distribution that we know is so needed for acutely sick COVID patients. Now, hospitals that have aging infrastructure are having problems with oxygen tanks freezing, pipes not having enough pressure, and a shortage of single-use tanks.
We're trying to assess how we can reduce the strain on their facilities and their mechanical spaces and O2 oxygen distribution as well. They're working contract solutions and emergency solutions to bring in additional oxygen trucks that can connect to their emergency oxygen systems to be able to alleviate some of their challenges.
Science is great. Just to be clear, oxygen tanks do not freeze. Especially in LA, they don't even in Canada when it's -50. What the hospitals are experiencing is the pipes are small throughout the facility, and when you suck tons of oxygen out of the end of the pipes all over the facility to try and give high oxygen to COVID-19 patients, the system just basically stops working. So then you have to use portable tanks, and there's not enough portable tanks. So they've asked the Army Corps of Engineers to come in to see if they can figure out how to deal with that. A little late, should have been done months ago. In fairness, in Ontario, we didn't do this either months ago. My hospital, so far, is actually able to pipe the oxygen where it's needed to go. Now, if we start doing multiple ICUs throughout the facility, i.e. converting floor patients into ICU in situ, that situation might change.
We're clearly practicing crisis medicine right now, and really the principles of triage is to do the most good for the most number of people.
As hospitals deal with the current volume of COVID patients, they're also looking for ways to increase capacity as they expect another surge in the coming weeks. City and county health officials say they're now making very tough decisions about patient care.
Every hospital is really is under duress right now. There are no ICU beds, irrespective of anything else, whether it's COVID related or not.
Dr. Mark Eckstein is the Los Angeles Fire Department's EMS Bureau Commander and Medical Director. He says the latest directives given to ambulance crews by the LA County Emergency Medical Services Agency make a lot of sense given how stretched the healthcare system is right now. To reduce demand on hospitals, crews have been advised to not transport patients who have virtually no chance of survival.
We're not talking about rationing care of who gets resuscitative efforts or not. We're talking about only transporting cardiac arrest victims who had successful resuscitative efforts.
Ambulance crews have also been told to cut back on their use of oxygen to ease the strain on medical supplies needed for the sickest patients. Dr. Eckstein says the majority of patients who need oxygen are COVID patients with COVID pneumonia.
Now, if the patient saturation is above 90%, we're telling our EMTs and paramedics don't give oxygen because A, it's not going to help the patient. You just have to be above that threshold of 90%, and B, it's wasting a scarce commodity.
Dr. Eckstein oversees the second busiest provider of EMS in the nation, serving a population of over 4 million. He tells us they're working with area hospitals and local leaders to make sure their paramedics and EMTs are able to respond to critical 911 calls.
And it's not just COVID, the routine emergencies that we respond to on a daily basis, whether it's a car accident, a stroke, a gunshot victim, a heart attack, we have to be able to respond.
But how dire is it in some parts of the world? Right now, not next week or the week after, could maybe get dire. No, what is it like on the ground right now? Well, in certain parts of America, ambulance crews are no longer picking up patients who are almost dead. They go to 911, they see the patient's almost dead, they leave them there. They're not picking them up, they're telling the family that when they actually die, or the police when they actually die, call the funeral director. That's how dire it is. One of the interesting ones is coming out of England, and I will show you that one right now and talk about it as I scroll through it. You will need to pause the video if you want to read the communication from a British hospital in detail. So this is a typical Happy Christmas message. It's not very good. It's giving people actual information, which is great. The ACCU, I'm guessing, is the acute care COVID unit. Across 2 floors, 2 pods, blah blah blah. They're telling people they have 90 acute care COVID patients. They're saying it's still increasing rapidly. They don't have enough oxygen supplies, and they have insufficient nursing. And they're also saying, guess what? We're actually in a better state than a lot of our other hospitals are in our local area. And they're saying that Kent, which is a county outside of London, is even worse. They're saying things are really bad. They're saying what they're doing. They're giving them absolutely specific information. Now this is quite fascinating. Normally trauma calls, code blacks and cardiac arrests are done by consultants, staff physicians who know what they're doing, but they can't anymore. They're so stretched now with doctors, let alone nurses, that they can't. So they're looking at trying to get people who are not trained and not specifically able to cope with these codes to go to them. And that's, I think, is a very, very important thing. So they're actually doing what they need to do. They're restricting what they're doing. They're actually going to use anesthesia because most surgical cases have not been done, and they're talking about how they're doing it, and they're talking about what they're trying to do. So then they say, okay, this is a situation, this is what we want to do. So they're going to expand, they have no choice, they're going 1 to 3 nursing ratios for ICU, they're doing a whole bunch of stuff, they're getting consultation, more doctors as far as they can find them, they're going to ask nurses daily to come to work, and they're going to have a team meeting every day. This is the critical part. We would like to take this opportunity to reiterate the fact that we're now in disaster medicine mode. This is the United Kingdom. We are no longer providing high standard critical care because we cannot. While this is far from ideal, it's the way things are and the way they have to be for now. In terms of how much you do for each patient, discuss this with your nurse in charge and our medical team. Some will need hourly observations, that's vital signs, others will not. Some will still need 4 hourly rolls, that means turning, but others may be okay with 2 rolls a shift. This may even change during the shift. This is absolutely awful. Patients who are ICU, patients who are critical, need to be turned about every half an hour to an hour for various good reasons. They're just not able to do it, they don't have enough staff, and they've given up. They can't. So this is fascinating as well. Things are going to get harder before they get better, and eventually they will. Vaccinations will be here in a few months and the numbers will drop. But at the moment, in the United Kingdom, they are absolutely unable to provide, in parts of the United Kingdom, reasonable, normal critical care. And that's an acute emergency that we can't fix. We haven't trained auxiliary nurses, we haven't trained members of the public for the last 10 months who've been unemployed to go into these units and assist trained registered critical care nurses. We haven't done it in the United Kingdom, and we certainly haven't done it in Ontario. And that is a huge error. That was a huge mistake. Boots on the ground is utterly vital. We don't have the army that are able to do this. They're not trained to do this. We have lots of nurses out there that we could have trained, but they're trying to train them now. It's not going to work. For example, my hospital is hiring 31 ICU nurses and going to put them through the program for a year. That's not going to help right now.
Now, the record number of people in the hospital right now is leading to some tough decisions for doctors and medical staff. An internal email sent to NBC4 raises some alarms at San Gabriel Valley Hospital. NBC4's Beverly White has details now. One doctor describes as shocking. Beverly.
That's right, Colleen. That internal email comes from hospital leadership, the CEO and the chairman of the board of directors. It was so upsetting to one doctor that they sent it to us anonymously. The Serenity outside Methodist Hospital Arcadia tonight belies the turmoil a memo sent to staff says is happening inside. On official letterhead, the email says as of this morning, Methodist Hospital is caring for a total of 233 patients, over half of whom are COVID positive and in isolation. We have 27 patients in ICU, which represents full occupancy as we continue our efforts to hire nurses and staff additional critical care beds. That email came after LA County Public Health said this about hospitals rationing care.
No hospitals have declared crisis standards of care. Per an all facilities letter from the California Department of Public Health, hospitals are required to declare that they are operating under crisis standards of care.
The words crisis standard of care do appear in the Methodist Hospital email. No surprise to this cardiologist.
I've been in agreement with that statement for maybe about 2 weeks now, so ever since the surge of the COVID crisis.
Despite repeated efforts by NBC4, Methodist Hospital is not talking about the email. And while Dr. Christodoulou was not our source, he's seen it and agrees with the urgency.
We lack the nursing care, the ICU nurses, the personnel to take care of not just the COVID patients, but anybody who has just regular pneumonia, a regular heart attack.
The Methodist email also says this: please inform your patients and their families that at this time they may have limited options regarding care in the hospital. And when appropriate, please ask your patients to establish an advanced healthcare directive or a do not attempt resuscitation, DNR, order. That's explained by NBC4's expert, Nurse Alice Benjamin.
A group of usually about 5 different people from different disciplines who are not involved in the patient's care. They take a look at the clinical situation and then make a determination as to whether someone should receive or not receive a particular treatment.
Cases skyrockets. The NBC4i team has learned about more than 100 new outbreaks at local supermarkets. More than 800 workers have been infected. And as investigative reporter Joel Grover reports, even though stores have strict safety measures, employees are still getting infected and some customers are still defying mask-wearing rules.
Do not care about people's lives. You are inconsiderate.
Angry customers confront a man not wearing a mask inside this West Hollywood Ralph's store, seen on cell phone video given to the I-Team.
Pick up your face diaper.
A few feet away, other maskless customers stroll around like this woman. It's a sore subject for the employees, especially since 4 of them reported to the union they were recently infected with COVID-19. Workers at other Ralph's stores say they've also been infected.
Well, that's exactly right. The super spreading areas are big stores and malls where large numbers of people are gathering and moving throughout the day and breathing out and not altogether always wearing masks correctly. Most people are wearing masks in Ontario, but even if they're wearing them correctly, they'll often have the nose exposed, they'll often open them up to talk. There's a lot of hand washing that's not being done after touching masks. There's a whole bunch of issues why big malls, Walmarts, Costco's are places you need to avoid at all costs or go quite early before people have been in there and wearing N95 while you're doing it, or at least 2 decent surgical masks. The other one, of course, that I've said before, is schools. Schools are absolutely super spreader sites. There's no question about this, and why schools opened in September across the Western world, I don't know. It was absolutely ridiculous. There's no way children are getting a decent education. There's no way they're getting proper socialisation. It is a pretense that everything has to be normal as long as kids are in school. England, I believe, has shut down schools. Ontario shut some of the schools down this week. It's too late. Kids infect each other, go home and infect everybody else. They absolutely could have had teachers and community support going between this September and next September into the communities, using the empty sports arenas, using the empty schools to have small groups of children come for an hour or 2 once a day or every 2 days, get a decent meal, take some packed lunches home with them because hunger's a big issue for a lot of people right now, and have some outdoor or indoor, very distance, formalised, focused fun. And then next September, September 2021, when most people have been vaccinated, apart from a few crazies, they could have actually opened the schools properly. Schools, colleges, universities are additional to what we need as a society. They're absolutely critical going forward, but we could have paused them for a year, and we should have paused them for a year, and we shouldn't be allowing people not to go into small stores by one person at a time. Let's close them down, but let's allow people to go to Walmart. It's absolutely nuts. I understand it, there's economic issues here, but the bottom line is, this is a war against a pandemic. We are fighting a virus. Until we're all vaccinated, or it's wreaked havoc throughout the entire population, we're in deep trouble. And we need to actually act like it was. Almost 4,000 people a day now are dying in America. Almost 4,000. That's over 1,000 people dying under the age of 60 who are fit and healthy. This is outrageous. And it was clear to me, and it was clear to a lot of people, this was going to be the end point, with inadequate education, without inadequate support, and with inadequate faith in what the government was saying. Blame various politicians, but you know who I blame? I blame all those preppers out there who trivialised this right from the beginning. I blame them, because they've killed people, either directly or indirectly. The climate is, it's no big deal. The climate is the governments are overreacting. The climate is that the vaccine's unsafe. The risks from the vaccine are absolutely trivial compared to the risks from not being vaccinated. Trivial. And I don't know why people keep rambling on about nanoparticles and Bill Gates and all the rest of the woo that's going on in their heads, because they've seen video evidence on YouTube channels. Yeah, I'm a little annoyed. I have to go to work. I have to deal with the consequences of profound ignorance and stupidity in a large minority of the Canadian population. But it isn't all the gatherings. It isn't. It's the schools. It's the shopping. All of those unnecessary eating out things that Guns Coast to Coast correctly pointed out. Why are you going out eating? Why are you going through drive-thrus to get a coffee, cranking the window down, taking a coffee from a worker who's wearing a mask, and you're not wearing one? Why are you even being served? I would ask everybody out there to promote social distancing, promote safe and effective mask using, and to really try not to congregate or break the obvious. No matter what the governments are telling you, keep your distance. A mask doesn't allow you to forget distancing. Distancing is critical. A mask helps. Okay? Wash your hands frequently. Wash your hands every time you touch your face when you're outdoors. It's critical. Ontario's probably going to get a curfew, I can see that coming, because we don't know what to do. Our hospitals are overwhelmed. We're still clinging to normalcy in terms of how many staff we have per patient. There's a whole bunch of issues there. The people in charge of it are really calcified on the main. They are not able to be flexible, nor to think outside the box, and they certainly don't seem to understand the severity that the frontline nurses at my hospital are seeing. They don't kind of get it. Anyway, that's all from me. Have a great weekend. I undoubtedly won't, and I'll be back next week. I hope you're all fine, and take care. And this is not meant to do anything other than just to inform you of things I've seen on the news that I think are worthy of you guys watching as well, and also to, in this case, give some analysis from my role, not as a clinical expert in virology or epidemiology, but as a hospital administrator at a hospital that's having to shove patients out night and day and take patients in night and day, whilst we're trying to juggle the few remaining ICU beds in the province. Okay? It's serious. It's always been serious. Please consider where you get your information from. Please consider why people want you to believe this is not an issue. They have not got your best interests at heart, and they never did. Toodles. This has been a Wolfie Terrier production 2021.